Welcome to our webinar on Innovation in Action, exploring the boundless potential of digital ICU. Join us as we delve into the dynamic world of digital ICU, where seamless data integration, real-time insights, and advanced analytical skills of technology revolutionize patient outcomes and shape the landscape of modern healthcare. Let's begin this exciting exploration together. The agenda of this webinar is to explore the future of critical care with leveraging technology for enhanced patient outcomes, addressing the challenges in critical care with shortage of resources and rising ICU bed demand, transforming care delivery and empowering ICU with advanced digital solutions, driving informed decisions on how technology-powered CDSS elevates critical care practices, revolutionizing care coordinations and enhancing efficiency with a centralized model, unlocking versatility, seamlessly integrating third-party data, measuring success by improving patient outcomes and streamlined workflow with digital ICU adoption, and last but not the least, engaging discussion addressing your queries and insights on the future of digital ICU. The current issue which we are facing in digital ICU is the scarcity of qualified intensivists and nurses that has emerged as a significant concern in the healthcare sector. With an ever increasing number of critical patients, the need for experts and medical professionals in intensive care units is higher than ever. The demand for ICU beds have been steadily rising each day, putting a strain on healthcare facilities worldwide. The current issue have resulted in a surge of critically ill patients who require immediate access to specialized care and monitoring. In this digital age, the persistence of manual transcription of vital signs is hindering the efficiency and accuracy in the patient care. So automating this process is crucial to streamline the data collection and ensure the timely interventions. As the complexity of medical cases are increasing and patient inflow surges, healthcare providers are facing an overwhelming increase in the quantity of tasks they need to manage day by day. So this has the potential to affect the quality of the care provided to the patients. So moving on, 25% of the US beds are tele-ICU. So as a recent data, India has emerged as a global leader in digital transactions with a significant adoption rate across the various sectors. Its progressive approach towards digitization has revolutionized the way of financial transaction that are conducted in the country. On the other hand, while the US is currently accounting for only 2% of the digital transaction, it has made a remarkable stride in another crucial area of the healthcare with 25% of the beds equipped with tele-ICU technology. US has embraced innovation in critical care management. Tele-ICU allows remote patient monitoring and real-time communication between off-site medical experts and bedside team, leading to improved patient outcomes and streamlined care delivery. So both India and the US showcase their strength in different realms of the digital advancements, with India excelling in digital transaction and the US leading the way in the implementation of the tele-ICU technology. But the development highlights the ongoing efforts that is needed to harness the technology for a positive impact in various aspects of our life, from financial transactions to healthcare deliveries. So moving on, let's get to know what digital ICU exactly is. So in this segment of our webinar, we'll delve into revolutionizing world of the digital ICU, where the technology meets the compassionate patient care, which embraces digital innovations. And embracing digital innovation, the digital ICU transforms traditional critical care settings into advanced interconnected ecosystem, empowering healthcare professionals and elevating patient outcomes. The key points that we have addressed in the digital ICU are seamless data integration, to discover how the digital ICU seamlessly integrate the patient data, vitals, medical devices, and offering a comprehensive real-time view of each patient's health status. Remote patient monitoring helps to empower the power of remote patient monitoring, where off-site teams can access the critical patient information and collaborate with the bedside staff for timely interventions. Clinical decision support system is the key and heart feature of the tele-ICU that uncovers how CDSS engine aid healthcare professionals in making informed decision by providing evidence-based insights and alerts. This enhances care coordination, and this helps to learn how the digital ICU foster effective communication and collaboration among the healthcare team, which optimizes care coordination for better patient outcomes. The advantage that has added in tele-ICU is the third-party integration. To understand the benefits of integration of third-party devices such as ventilator and infusion pumps to create a versatile and unified care unit, tele-ICU comes in the picture. Let's discuss about the device integration, which again is the seamless integration besides the ICU devices such as patient monitor, ventilator and syringe pump into one cohesive platform, that is tele-ICU, which enables real-time data synchronization and remote monitoring. By doing so, by providing the integration, it empowers healthcare professionals with comprehensive patient insights, fostering timely interventions and improved decision making. Okay, so with the device interface, the burden of manual data entry is eliminated. We are streamlining the workflows and reducing the risk of errors. It is user-friendly design which ensures the efficient integration and also making it essential tool in optimizing critical care services. Moving on, we have a centralized model. The centralized model revolutionizes critical care by enabling a command team to standardize care protocols, reduce patient transfers and optimize bed utilization at remote locations as well. By leveraging this model, healthcare facilities can provide consistent high quality care to the patient while efficiently utilizing the available resources such as the caregivers and the providers. Enabling remote access for seamless care is the heart of the tele-ICU bedside, featuring a tablet and a PTZ camera. This innovative setup grants the offsite team complete access to the patient and enables seamless communication with the bedside team. Real-time patient interaction and monitoring is also possible through tele-ICU. So what happens is, equipped with a PTZ camera and a patient monitor, the ICU bed becomes a window for the offsite team to interact with the patient and the monitor vital signs remotely. The tele-ICU bedside ensures that the critical data is readily available to both teams, facilitating swift decision making and improves patient's outcome. The facility of video conferencing for off-site clinicians can conduct video conferences with bedside teams, fostering real-time communication and collaboration with the comprehensive patient care. I also have 24/7 chat support, which bedside teams have continuous access to and can connect with off-site clinicians through the chat feature, facilitating quick consultation and support. Alert and notification are also provided in tele-ICU app, so the system ensures that the bedside staffs and the physicians receive timely alerts and notifications, which enables them to promptly take action and understand the criticality of the patient's situation. Now we have patient monitoring dashboard, which has been integrated with multiple devices. So by seamlessly integrating advanced sensors and smart devices, the digital ICU empowers healthcare professionals to remotely monitor patients' vitals, allowing the real-time data and early detection of potential complications. This is not only to enhance the patient safety but also enables proactive interventions, improving overall outcomes. Furthermore, the digital ICU streamlines the workflow, through automated data entry and smart alerts, reducing the burden of the healthcare staffs and minimizing the risk of the errors. This efficient use of resources also allows for better allocation of medical personnel and contribute to the optimization of the critical care. Moreover, the digital ICU, what it does is it facilitates the data-driven decision making, enabling clinicians to access comprehensive, patient information at their fingertips. And also, this is an evidence-based approach to lead and to be more precise diagnosis and personalized treatment plans. Ultimately, it enhances the quality of the care provided to each patient. So the benefit of the digital ICU again comes to extending beyond individual patient care. The aggregation and analysis of the anonymized data from multiple ICU cases enable healthcare institutions to gain valuable insights into trends and treatment efficacy, and best practices are to provide all the data available to the patient digitally. This invaluable knowledge fosters continuous improvement and drives advancement in the critical practices globally. Introducing the providers application. In the heart of this session lies the Tele-ICU Providers app, a game-changing solution that brings advanced critical capabilities to the palm of your hand. Designed for the healthcare professionals, this application redefines the remote patient monitoring, communications, decision-making, revolutionizing critical care practices worldwide. The key feature are the real-time patient monitoring insights, experiencing the power of real-time patient data at your fingertips. The Tele-ICU Provider app delivers comprehensive vital signs, lab reports, monitoring data, enable timely intervention and decision making no matter wherever you are. So seamless communication helps the caregivers and providers to stay connected with your team effortlessly. With built-in secure messaging and video conferencing features, the collaborating with on-site and off-site experts have been never easier and ensuring a cohesive approach to the patient care. We also have clinical decision support system, as I mentioned earlier, which elevates your clinical decision with the app's technology-driven support system, receiving intelligent alerts, evidence-based guidance, and personalized treatment recommendation, all tailored to enhance patient's outcome. So basically, at the end of the complete process, patient enhancement is kept on the top. The feature that the Tele-ICU is providing are the providers app, which revolutionizes care on the go. We have effortless documentation, precision and efficiency in streamlining orders with CPOA. We have visual insights for better patient care, ensuring patient safety, empowering nurses, empowering the care one step further with tailored instruction and diet plans. We have virtual presence and real care, bedside camera for remote monitoring, virtual collaboration with Tele-ICU video conferencing. We have instant notifications, enhancing smart alerting. Timely actions are also noted for that. We have transparent and hassle-free simplifying patient condition update. So we can also enjoy sound sleep and continuous care at the same time with nighttime monitoring for peace of mind. Moving on, we have clinical decision support system, and the flow begins with the engine fetching patient data and demographics from electronic healthcare records and other relevant sources. So the data which has been received are vital signs, lab reports, medical history and clinical documentations, which provides a comprehensive view of patient's health status and medical context. The CDSS engine basically employs advanced algorithm analytics to analyze this data, the patient data, and cross-reference it against evidence-based guidelines, medical literature, and the best brings the best practice for the same. As the analysis progresses, the engine generates real-time decision support alert based on the patient-specific condition, treatment protocols, and risk factors. depending on the critical signs and the vital lab reports and medical history which has been received. The alert are categorized and prioritized to ensure the healthcare providers to receive the most critical result and information promptly, then seamlessly communicating these alerts to nurses and providers involved in the patient care through the hospital communications. The platform is integrated to manage the entire process. Once the alerts are received, the healthcare providers take appropriate actions based on the system's recommendation. This may involve in adjusting the doses, ordering tests, or considering alternative treatments. So the entire flow is customizable. The engine continues to monitor the patient data and the clinical documentation in real time, which again updating the healthcare providers, updating its analysis as a new information comes into the picture. It learns from the past interactions also and the outcomes also. So overall, the CDSS flow optimizes clinical decision making and enhances patient care and contributes to the improved patient outcomes. So this is how our CDSS work with the lab data and lab reports, and once the engine fetches the entire data, this shows the alerts to the digital ICU platforms from where the providers and the caregivers can take an action on the same. Coming down to command and control session, which serves as a heartbeat of digital ICU, orchestrating seamless patient care with advanced technology. So this centralized hub basically is a combination of multiple locations, and again the hub enables remote monitoring, real-time data integration, and instant communication between off-site and on-site experts. So moving on with a comprehensive view of the critical patient information, the command and control center empowers the healthcare professional to make informed decision and optimize the resource utilization. So this revolutionizing critical care elevates patient outcomes and shapes the future of the healthcare in a very positive aspect. Moving on, we also have Sandbox API. So basically in our digital ICU, we have introduced revolutionary Sandbox API, which is a powerful tool that unlocks the boundless possibilities for healthcare innovations. The Sandbox API serves as an integrated playground, facilitating the seamless integration of third-party devices and application into our digital ecosystem. So the main feature of the Sandbox API is its ability to streamline the connectivity and the interoperability, which allows allowing the medical devices, EMR system and clinical applications to communicate efficiently and effectively with our platform. The integration empowers the healthcare providers with a real-time access to diverse patient data, ranking providing the lab reports and the vital reports to the medical devices and for smart alerts. So the healthcare professional can harness the power of data-driven decision making and clinical insights from the API integration, well-known data transfer. It also allows for creation of personalized patient care pathways, efficient data exchange and customized workflow, ultimately elevating the care of the patient and enhancing patient outcomes. We also have a major feature called OCR of lab reports in digital ICU, which allows for seamless digitization and integration of paper-based lab report into our advanced digital ecosystem. So by converting the physical text into the digital data, healthcare professionals gain real-time access to the critical patient information, which enables a fast decision making and proactive interventions. So this technology eliminates the need of manual data entry, reducing the risk of transcription and error, and streamlining the workflow of the complete system. So basically with the OCR, the lab reports become instantly accessible, facilitating data-driven care plans and supporting evidence-based treatment decisions. So overall, the outcomes of our a webinar is the quality care, which elevates patient care through real-time data insights and evidence-based decision making, Also reduces length of stay by streamlining workflow and optimizing resource utilization and shorten patient stays. We also works on lower mortality and morbidity by enhancing patient outcomes with timely interventions and continuous monitoring. We also have lesser staff burnout, empowering healthcare professionals with efficient tools and reducing the stress and enhancing job satisfactions for the healthcare professionals. We also keep in mind about the seamless workflow to integrate devices and data seamlessly for a cohesive and streamlined care environment. We also operate on lesser cost to optimize the resource utilization, leading to the cost saving and efficient healthcare delivery. We focus on the E4 the style of the working, which is efficient. The digital ICU offers a mobile full featured platform which empowers the healthcare professionals to access critical patient data and also monitor the vitals on the go. So with a low doctor to patient ratio, the digital ICU can optimize resource utilization and enables the physicians to focus providing the personalized care to each patient. Also early detection of complicated situations through real-time data insights also prompts the notifications and alerts. The digital ICU also ensures a seamless workflow by integrating medical devices and data, streamlining communication between the on-site, off-site, and internal team, and minimizing manual data entry. The digital ICU is also follows easy, embracing a vendor agnostic approach. So the effortlessly it integrates with the medical devices. Plug and play functionality also simplifies the setup and implementation. The single screen hub healthcare professional are available, and they can have a centralized access to all the patient care information, enhancing the efficiency and reducing the cognitive overload. We also have economical digital ICU, which minimizes the revenue leakage by optimizing resource utilization, by reducing the waste and ensuring the efficient documentation process. By enabling patient monitoring and care coordination, the ICU reduces the need for patient transfer, leading to cost saving and improved patient satisfaction. We also have automated process and advanced technology, the digital ICU, which helps healthcare facilities save on manpower costs and allocate resources more efficiently depending on the number of beds and the services they need to address. The expertise that we have on the digital ICU boosts an experienced team of intensivists providing remote expertise and support to bedside care teams, which enhances clinical decision making. We also have offering nighttime vigilance packages that ensures monitoring and support during the critical night hours. We also have clinical decision support system with our expertise that the digital ICU empowers healthcare professionals with evidence-based insights and intelligent alerts, which enhances the patient care and treatment again. So this was all from our digital ICU. Let's get on to the question and answer rounds and your insights on the tele ICU.